Dr. Alon Antebi is a level 1 trauma surgeon, orthopedic surgeon. Doctor, thank you for joining us by phone because we have this information just in from Tiger's doctor where they're saying that he's going to have screws and pins. They were used to stabilize his foot and ankle. What can you tell us about what you're hearing?
Yeah, typically with these types of, high velocity injuries, this is what this is, just from the pictures that I saw of his car. And again, I can't really speak until we actually see the x-rays. But from what it sounds like he sustained some what we call compound fractures to the tibia. The bones are what we call comminuted, and what that basically means is it's not just a clean break. It's multiple pieces. And I'm not sure if he broke both legs or if this is just multiple breaks in the same leg. But it sounds like from what you guys were saying that he may have gotten a rod in one of the legs. And he also sustained what's called a compartment syndrome, which requires what's called fasciotomies. There's so much swelling that occurs from these injuries that the blood flow to the leg can no longer be sustained. So we have to do what's called fasciotomies, where we actually literally cut the skin and the fascia. The fascia is kind of like the lining around the muscle in order for the muscle to be able to breathe and get perfused with oxygen. These wounds remain open for several days until the swelling subsides. Sometimes the swelling is so great that we cannot close these wounds, and the patients require what's called a skin graft, where we literally take skin from one part of the leg and the thigh to cover these open wounds. So a lot of times these types of fractures require several surgeries and require hardware. Depending on the type of fracture and where the fractures are, well, like you said, will depend on whether he's able to bear weight or not bear weight on these legs. So definitely a long recovery with a lot of physical therapy, rehabilitation, and not to mention pain and discomfort that he's going to be going through.
Is this the kind of thing where there's a chance he may not walk again? And on the other end of it, is this the kind of thing where there's a chance that he could once again be one of the top athletes in the world and play golf at a competitive level?
Yeah, a lot of this really depends on, and again, I've not seen any x-rays. If I had his x-rays, then I'd be able to comment a little bit more. But if his injuries actually involve the joint, there's a type of fracture that occurs with these types of injuries called a pilon. It's P-I-L-O-N, kind of like a pylon fracture. And these are devastating articular injuries, meaning they actually happen in the joint, not in the long part of the joint, but in the actual joint, not in the long part of the bone, but the actual ankle joint. And when these happen, the amount of cartilage damage that occurs to these types of fractures and injuries are absolutely devastating, especially when they're open fractures, meaning compound fractures. It takes months and months of recovery. There's a lot of stiffness that's involved with these type of injuries in the long run. Sometimes you get what's called non-unions, where the bone doesn't heal and requires further surgery. Sometimes hardware needs to be removed. So, I mean, again, without seeing the actual films, I can't really comment as to his injuries, but it sounds like he definitely had some compound fractures, which are open fractures, which have a higher rate of complications with infections and what we call non-unions, where the bone just doesn't heal because all the blood supply and what we call the periosteum, which is the covering of the bone, which is required for optimal healing.
Well, Dr. Alon Antebi, we thank you so much for your detailed insight as to what's going on here. Thank you so much for jumping on last minute here at 10 o'clock. We appreciate that. The good news...
I just got out of surgery, so it was great timing.
We thank you. We thank you. The doctors for Tiger are saying that he is awake and responsive, so that part is a good thing.